In the past week, Florida has had more COVID cases than all 30 states with the lowest case rates combined. And Florida and Texas alone have accounted for nearly 40% of new hospitalizations across the country.
We're seeing a rising number of children being infected with COVID-19. So I have a twofold question. Is there data to suggest that the Delta variant is more virulent in children? And given that increase, are you still confident that schools can fully reopen for in-person instruction, or are you considering further changes to the guidelines?
Well, in answer to the first part of your question, there's no doubt that there are more children getting infected. As I mentioned in one of my slides, the Delta variant is much more highly transmissible than was Alpha. So given that, you'll see more children likely get infected. And since you have a certain percentage of children, even though the percentage is small, certain percentage of children will require hospitalization. So quantitatively, you will see more children in the hospital. Regarding the severity of illness, there was a couple of studies, mostly international, which suggested that Delta was more severe in adults, namely causing more relative percentage of hospitalization and more severe disease. With regard to children, this could possibly be the case, but we are not seeing this in a definitive way. The only thing we know for sure is that more infections mean more children will be in the hospital.
As we've been saying for weeks, emerging data show that certain people who are immune compromised, such as people who have had organ transplant and some cancer patients, may not have had an adequate immune response to just 2 doses of the COVID vaccine. To be clear, this is a very small population. We estimate it to be less than 3% of adults. We've been working to identify how best to provide increased protection to these vulnerable people who are disproportionately impacted by severe outcomes due to COVID-19. FDA is working with Pfizer and Moderna to allow boosters for these vulnerable people. An additional dose could help increase protection for these individuals, which is especially important as the Delta variant spreads. Following FDA's decision, CDC will hold a meeting of its Advisory Committee on Immunization Practices tomorrow to discuss this issue and offer their expert insights and recommendations.
We are aware of some cases of fraud or counterfeit COVID-19 cards being advertised on social media sites and e-commerce platforms. While the practice is not widespread, I will remind everyone that it's a crime, and the Office of the Inspector General, the Department of Health and Human Services, is investigating these schemes.